She's a 28-year-old female who presented to our clinic with spontaneous galactorrhea. Her serum prolactin was noted to be 62.6, and the MRI of her pituitary demonstrated a macroadenoma impinging on the optic chiasm. Review of systems was essentially negative. There were no visual defects, and her menses were regular. Past medical history was significant for a seizure disorder thought to be secondary to a left temporal cavernous hemangioma, which is status post-resection in 2003. She has not had any seizures since the time of resection. She has a mood disorder, sort of undifferentiated, as well as a history of polycystic ovarian syndrome, though I think this diagnosis is somewhat in question given that she has normal menses. She is on birth control pills, however, but before starting them, she had normal menses. Family history is non-contributory, no tobacco, alcohol, or drug use. Her vital signs within normal limits. Her visual fields are intact. She did have expressible galactorrhea on exam, and the rest of the physical and neurologic exam was unremarkable. Labs from October 2009 in the afternoon had a normal chem panel and CBC. Her cortisol was 11, her ACTH was 7, growth hormone was 3.1, IGF-1 was 151. Thyroid function tests were also within normal limits. Of note, her estradiol was low, less than 12. Her FSH was 3.2 and LH were 0.4. Similar to our first study, probably secondary to the birth control pills. And again, her prolactin was high at 62.6. So the preoperative diagnosis is a likely non-functional pituitary macroadenoma impinging on the optic chiasm. And the mildly elevated prolactin levels in galactorrhea are thought secondary to Stalk effect.